Hello guys, welcome back to my YouTube channel. So today I want to talk about sex and pregnancy. What do I want to talk about? Sex and pregnancy. So if you're new here and you've not subscribed, please kindly do so. Like my video, share and comment. We are continuing with pregnancy series. So if you like the content, please you will consider subscribing, like, share and comment. So this is a question that have been asked most of the time. Is it safe to do sex when you are pregnant? What are the reasons or what are the conditions or things that can make you or can limit you to have sex when you are pregnant? And is it advisable to do sex when you are pregnant? So most of the time, most cases, when your pregnancy is normal, there are no limit, there are no any other conditions that can limit you from having or enjoying sex. Then you can do it from day one to the day you are delivering your baby. So I said that when you don't have any condition or when your pregnancy is normal, then sex is safe from day one to the day you are delivering. Of course, when you're pregnant, the interest might go away. Sometimes you might feel uncomfortable. Sometimes the feelings may not be there, and those are normal. They are things that you and your partner should understand. But if you feel you are comfortable, the pregnancy is normal, then you can go ahead. And now, let us look at the reason why sex might not be safe when you are pregnant. Number one, if you have threatened abortion. When you're pregnant, at any given time, you should not see blood. When you see blood, when you are pregnant, you should go and check. Yeah? Sometimes we always say that it is normal when the implantation is taking place, you might have some spotting, but it is just light spotting without no cramps, it is just comfortable. But when you have vaginal bleeding and you're pregnant, it might be threatened abortion, it might be abortion, any type of abortion. So at this point, this pregnancy, you will have to carry it with a lot of care. Now, the doctor will and must advise you not to engage in sex when you have threatened abortion. I hope you've gotten that right. Number two, we have those women who have incompetent cervix. Just a small trigger and the pregnancy is out. So this kind of women will be advised not to have sex at any given time when they are pregnant. And most of all these women, sometimes they're always they can be stitched. They can be stitched, and that stitch, we call it McDonald's stitch, so that the pregnancy can be contained up to the term, so that you deliver a normal baby or you deliver a baby when you are at term. So these kind of women who have incompetent cervix might not have sex when they are pregnant, or they should not have sex when they are pregnant. Number 3, low-lying placenta or placenta previa. Placenta previa is a situation where placenta is situated in the lower uterine segment. So any trigger that can cause a small dilatation of the cervix might cause bleeding, might cause complications. So you will be advised not to have sex when you are having this kind of placenta, low-lying placenta or placenta previa. Number 4, when your water breaks. When your water breaks, you should go to the hospital immediately. If the water breaks, you should go to the hospital immediately. And you are not supposed to have sex because you might introduce infection to the baby. So in fact, when your water breaks before term, you might end up delivering a premature baby. So you will be advised that you should not have sex when it happens. Immediately you experience that, you go to the hospital, right? The next one, when you are having twins or when you're carrying more than one baby. When you're carrying more than one baby, sex might trigger premature contraction or may trigger contraction because of the enlargement and the stretching of the uterus, and maybe the pressure that the babies are putting on the cervix. You might go to labor before term. So you will be advised not to have sex when you are having twins because you might trigger premature delivery. Another point, or point number 7, when you are a person who usually have early labors, you will be advised not to trigger any labor because you might go to early labor and you might give birth to a premature baby. And the next thing also, or the next point, when you are in your late stages of pregnancy, when you are 42, or when you are from 40 weeks, because pregnancy can go even up to 42. So when you are at, let's say, 39 weeks, at least you can rest at that point. But remember, I said you can have sex up to the day you are delivering when you have a normal pregnancy. So maybe at this point, maybe you're not advised to do it because maybe it can be uncomfortable because of the stomach is protruding, you are tired, it is uncomfortable, maybe you are only focusing to delivering the baby, you are only focusing to yourself. So those are just some of the things that might contribute to that point. And number 9, and is the last one, when your partner is having sex with other women without protection. So you will be advised not to engage in protected sex, or you avoid it at all, so that you protect your baby from getting infection, you protect yourself from getting infection. So I think I've reached the end of this video. So if you have not subscribed, please kindly do so. Make sure you support, and let's meet in the next video.